Hello, my name's Dr. Ron Daniels. I'm an intensive care consultant in Birmingham in the West Midlands, and I'm also the founder and chief executive of the UK-based charity, the UK Sepsis Trust. And we at the Sepsis Trust fulfil three critical functions. First, we raise public awareness so that members of the public know how and when to access healthcare if they're deteriorating in the context of an infection. Second, we support people affected by sepsis, whether they've survived it and have some challenges in their recovery, whether they are supporting someone who survived sepsis, which can be equally difficult, or whether they've been bereaved by sepsis. And the third thing that we do, and the reason I'm talking to you today, is we equip health professionals and carers with the tools, knowledge and skills to act quickly if someone they're advocating for or they're treating is beginning to deteriorate with infection. And that's why we are so excited to have partnered with NR Medical Training to deliver much needed awareness into the care home setting. Now, sepsis is an enormously common problem. Across the UK, it's estimated to affect 245,000 people every year and claim as many as 48,000 lives. Around the world, sepsis claims more lives than cancer. And as we age, or if we have underlying health problems, we are more at risk of sepsis. And that's why it's so important that you and the people you work with know what to do. Now, NICE issue recommendations around sepsis, including risk factors. And many care home residents will have one or more of these risk factors. They include advancing age. They include underlying conditions, particularly those which make infection more likely, such as diabetes or COPD. They include people who are receiving immunosuppressant therapy. Now, that'll include anti-cancer therapies, but it'll also include things like steroids that people might be taking for other conditions. People with indwelling devices, such as intravenous drips, such as catheters, are more at risk of developing sepsis. And so you can see that the people you advocate for have almost certainly at least one of these risk factors. Now, obviously, we recognise that not everyone who's a resident in a care home will be appropriate for hospital assessment and treatment. But the basics of sepsis intervention, which include, for example, antibiotics, can be delivered even for those residents in the community setting if hospital transfer is not appropriate. So it's really important that we all know and understand what to look for. And this training that we're delivering in partnership with NR Medical will deliver that information into your hands so that you can safeguard your residents. We very much look forward to working together on this to make sure that fewer people in your care come to harm from sepsis. Thank you.